Leber's hereditary optic neuropathy, or LHON, is a severe mitochondrial optic neuropathy disease. It was first described in 1871 by the German ophthalmologist Theodor Leber and was subsequently named after him. LHON leads to central vision loss in both eyes. It usually affects young, otherwise healthy individuals and is more common in men than women. Typical age for onset of symptoms is between 27 and 34 years of age. The birth prevalence of LHON is approximately 1 in 50,000 people, and it's estimated that 34,000 people worldwide have LHON vision. A sudden, painless blurring and clouding of vision are usually the first symptoms of LHON. These vision problems may begin in one eye or simultaneously in both eyes. If vision loss starts in one eye, the other eye is usually affected within several weeks or months. This is known as the acute phase. The rate of progression can vary from rapid to over 2 years, but most people are severely impaired by 3 or 4 months. Over time, vision in both eyes worsens with a severe loss of sharpness and color vision. LHON mainly affects the central vision, which is required for detailed tasks such as reading, driving, and recognizing faces. Peripheral vision generally remains intact. Although central vision gradually improves in a small percentage of cases, for most people the vision loss is permanent and visual acuity rarely changes thereafter. LHON is an inherited form of vision loss. This inheritance applies to genes contained in mitochondrial DNA. Mitochondria produce most of the energy that cells need to function through the electron transport chain. Mutations in genes of the complex 1 of the electron transport chain disrupt energy production in the mitochondria of cells in the retina, causing them to die. These ganglion cells are required to relay visual information from the eyes to the brain through the optic nerve. Egg cells contribute mitochondria to the developing embryo, so only females pass mitochondrial conditions to their children. Mitochondrial conditions can appear in every generation of a family and can affect both males and females, but fathers do not pass mitochondrial traits to their children. LHON has been associated with 3 primary mitochondrial DNA mutations at nucleotide positions 3460, 11778, and 14484, leading to missense mutations in NADH dehydrogenase. NADH dehydrogenase is a part of a large multi-enzyme complex 1 that generates ATP as a cellular energy source through electron transfer and oxidative phosphorylation. How these mutations in complex 1 elicit degeneration in the optic nerve is unclear. Those who have lost their central vision due to LHON are often referred to as affected, and those with LHON mutation gene but without vision loss are known as carriers. About 40% of individuals affected with LHON do not have clear family history of this condition. A person may carry a mitochondrial DNA mutation without experiencing any signs or symptoms of vision loss. Therefore, it is hard to predict which members of a family who carry a mutation will eventually become affected. If LHON is suspected, a blood test can determine if an individual has one of the primary mutations. However, LHON is a rare condition and most doctors will not have heard of it, and even experienced ophthalmologists may have never seen a patient with LHON. This lack of knowledge can lead doctors to suspect and treat for other causes of vision loss. Typically, a series of tests are performed to confirm LHON diagnosis or exclude any other conditions. Tests may include an examination of the optic disc, an electroretinogram to measure the electrical responses in the retina, a visual field test to characterize the area of vision loss, or an MRI or CT scan to rule out any optic nerve inflammation or other causes of optic neuritis. Current therapies are inadequate. The mainstay of treatment includes pharmaceutical compounds that are believed to restore electron flow or increase antioxidant defenses. One of these agents is idebenone. It is thought that the drug can preserve or re-establish retinal ganglion cell function during the acute phase and thus protect from irreversible retinal ganglion cell loss. However, based on the limited available data, it is not possible to make any statement on the probability whether anyone personally could benefit from idibenone treatment. A vitamin E-derived compound known as EPI 743 has been developed to be used as a therapy for the treatment of inherited mitochondrial conditions. A small clinical trial in 2011 showed promise when 4 out of 5 patients treated under clinical conditions demonstrated visual recovery. However, long-term safety and toxicology is as yet untested. Anecdotally, some patients are self-medicating with a range of mostly antioxidant food supplements. They include curcumin, brimonidine, lutein, and others have promoted inconclusive and most scientific research into this area seems to have ceased.